I think the stigma is that they're all really boring and really smart.
And how true is that, Mike?
You feel like you're on your own quite a lot of the time in GP. A lot of the decisions you make, it can be very tiring, cause you a bit of fatigue.
So I went into A&E after a year of already working on the wards.
Now that really is like casualty, isn't it?
Yeah, and it hit me hard.
Hi, my name's Owen and welcome to this episode of Coffee on Call, the Foundation Medicine podcast. Today I have with me Ruby on my left.
Hi.
And Mike on my right.
Hi guys.
And today we're going to be discussing about a day in the life of a doctor and what that involves. So let's start off with you, Ruby. So what would you say is your sort of typical sort of day in the life as a doctor?
So it depends where you're kind of coming from specialty-wise, but I guess medicine and surgery kind of, as a foundation doctor, ward-based for your jobs. So the day normally starts depending on, so my medicine day starts at 9, which is quite late. If it's surgery, it's normally 8:30, maybe even earlier. And then you meet to do handover, which is where you talk about the patients from the day, you talk about the jobs that there is still outstanding, or you talk about anyone that's been unwell. You can then flag that to your consultant, and you'll see the more poorly people first, and then you'll see all of the rest of the patients. Now, it's the age-old medicine versus surgery, isn't it? So you've got the medicine ward round can sometimes last up until 4 p.m, whereas the surgical ward round is often done by about 11:30, if not earlier, and then you're having a coffee and Costa with the surgeons. After that, you do the jobs that are generated from the ward round, so things like putting in a cannula, giving them antibiotics, doing their discharge meds, and writing their discharge summaries. And then often in medicine, a lot of the afternoon's spent speaking to families, giving updates, explaining things, whereas surgery, I would say there's probably more high frequency of unwell patients you need to review, because that's kind of just the nature of coming out of an operation.
And would you say that was quite a big shock for you when you started, or was that kind of what you expected?
I feel like that's kind of what I expected. Like, you watch TV and it's like, and the medicine is what I didn't expect, because it's kind of more laid back. You do the jobs and then it's more conversational, it's more arranging things for later in the week, whereas surgery is faster paced. So that takes a bit of getting used to, but it's nice to be able to like have those conversations with people as well.
And Mike, from your point of view, so what's a day in the life?
So I think Ruby's covered what it's like working on medicine surgery really well, but I think what came as the biggest shock to me was when I started my A&E job, because it was just so different to what I was expecting and what my other jobs had been like. So I went into A&E after a year of already working on the wards.
Now that really is like casualty, isn't it?
Yeah, and it hit me hard. But I really enjoyed it. I loved the job and it's really exciting. But basically you work a lot more on sociable hours because of the nature of A&E. You get patients coming all night. So you tend to be working out of hours more, and your day isn't nearly as structured. The way it works is essentially the patients arrive in time order, and they're usually seen in time order unless they're very unwell. And you'll pick up a patient, meaning you put your name to that patient, and it's your job to see that patient, and you'll see this patient for the first time. No one else has seen the patient. You have to organise all the investigations. You have to start the management. And then essentially what you're trying to do in A&E is decide if they're safe to go home or whether they need to come into hospital, which is actually sometimes very difficult to do.
Terrifying.
And a
Discharging
little
your
bit
first
terrifying.
patient's awful.
Oh, yeah.
So scary.
But I think it's just about being safe and, asking for help and getting that input. But then essentially what ends up happening is you accumulate these patients through the day. So as you go through the day, you build more and more patients who become your responsibility. And then you can either send them home or they'll come into hospital. And if you bring them into hospital, usually they'll be either seen by the team that's going to be looking after them, or they'll move to the ward and then they're no longer your responsibility. So your days, I say on medicine and surgery, I don't know if you'd agree, your day's very structured for you by your seniors.
Follows the same routine.
Exactly. Whereas when you move to A&E, it's much more driven by yourself and by your own workload.
Yeah. And did you feel, this is for both of you, but did you feel that, your lifestyle, your day in the life, did it affect sort of outside of medicine, like what you're able to do? And were you able to do like what you kind of like enjoyed and stuff like that?
Yeah, I mean, it definitely has an impact, doesn't it? And
on A&E more so, but I say on medicine and surgery, I was living the high life.
were you? Fair enough.
I like on my medicine job now, I'll like go to the gym 4 times a week. Not that you can tell, but you still have the opportunity to do
Give
those
yourself some
things.
credit.
Thank you. I'm trying. Going like to see your friends, at least like friends will come around for dinner, and you have most of your weekends if your rota's quite good.
Yeah.
So like this weekend I'm going to a festival, for example. There's stuff to do.
There's life outside of medicine.
On A&E maybe the rota less so.
Yeah,
but
I mean the A&E rota is particularly tough, but I mean equally I think the medicine and surgery rota is tough. You do a lot of hours. It's really demanding, really taxing work. So like I remember when I first started for 6 months, I'd come home and I'd just be exhausted and I'd really struggle to do anything. But then something kind of starts to click and you get used to it. And then all of a sudden, now I can do loads of stuff after work. I have the energy to go to the gym, see friends. So I really do have a good work-life balance now.
It's like anything though, isn't it? When you start work, when you come from university where you are on placement obviously a lot of the time, but you do have a lot more chill time, like downtime. Whereas even if you're a teacher, a builder, whatever it is, when you move from school to work, it's going to be challenging at first to get the balance right.
Because Elwyn, you're on GP now, aren't you? How are you finding that?
So I'm on GP, and I think after hearing what you guys said, my life is very different to yours. Quite 9 to 5. Bear in mind it is busy though, so sort of getting in the morning about 8:30, see my list for the patients in the morning. We get put on different durations for our appointments. So typically your normal GP might see in 10, 15 minutes. That's normally like a senior GP. But because we're just starting, we get about 20 to 30 minutes. So it can feel really fast paced. But a lot about GP is the admin, a huge amount of admin. And that can sometimes take up your day. So, sometimes you have to stay a bit longer just to do that referral, just to do that extra bit of work.
Do you take it home with you, do you think, your patients?
I think so. I think very much so, because probably the biggest difference between GP and hospital is you feel like you're on your own quite a lot of the time in GP. A lot of the decisions you make, it can be very tiring, cause you a bit of fatigue, mental fatigue and physical fatigue.
Is a massive thing.
Decision fatigue, so I think that's been the biggest thing I've learned from it, and that's probably the most realistic expectation of GP.
I guess that's the thing for the 5th years, actually, that hospital and finishing your jobs, the hospitals are a 24-hour service. There's always someone coming to take over from you out of hours to continue the emergency and important things. Whereas GP, I guess that's not. Okay, you have to kind of make a decision.
Yeah,
don't
there's a
you?
lot of risk analysis and working out, is this decision to send them to A&E appropriate? Is sending them home and not sending them to A&E, is that appropriate? It's very stressful.
Do you think there's the thing about sending patients to A&E from the GP with just like the letter? Do you think all of the things you send are always appropriate? Is there a bit of a rep there?
I think there's a huge rep. I think we get a lot of stick, to be honest with you, sending people to A&E when they maybe don't need to go to A&E. But do you
think it's true?
Maybe, but the truth is that you don't know what being a GP is like unless you've actually been in that position. So, working out what's safe and what's not is really difficult sometimes in GP. We don't have the scans. We don't have the immediate bloods.
So true.
That's sometimes really hard to make that decision. And we don't like sending people to A&E, but sometimes it's the best thing to do.
You get stick from us.
It's the safest thing to do, isn't it? So
it's very easy to say with hindsight that was the wrong call, but when you're actually just going off clinical exam.
What about surgery? Do you feel like they've got a certain? Do you feel like you get a bit
everyone's watched Grey's Anatomy. Everybody knows what the surgeon's rep is. And to be honest, I just don't think, having done a surgical and medicine job, like the surgeons are always the ones that take you for coffee after the ward round, are interested in like your life. They got to know you because they have to be able to trust you. They're not on the wards, they're off in theatre. So they need to make you feel safe to walk into their operating room and go, I need your help, can I have some advice? And also they're invested in building a better future for the surgical specialties.
I think surgical departments tend to be quite big departments as well. So I always felt there was a real team working environment when I had a surgical job.
Bit more
even though I
banter
don't want
as
to
well,
do surgery, but I did like the team working environment that was there.
Yeah.
Yeah.
It's fun. But I do think it has a stigma, and I think a while ago that stigma was true, probably. But not anymore.
And what about the stigma maybe with being a medical doctor or working in medicine?
I think the stigma is that they're all really boring and really smart.
And how true is that, Mike?
Well, I hope I'm not boring.
Are you calling yourself boring?
But I think, generally speaking, I think we've all said this, the best doctors we work with aren't the super intelligent ones that make all these crazy diagnoses no one's ever heard with. It's the doctors who communicate really well. It's the ones who really care about their patients, really demonstrate empathy. And those, in my experience, are what a huge number of the consultants I work with are like on medicine. They're really good communicators. They're really empathetic and they really care for their patients. And they really champion their patients. And that's why I really like medicine. Yeah. They really take the time to get involved in the detail of the patient and make the best plan for that patient.
I think the idea around medics is you're either Dr. House or you don't do much. And I think both of those house thing may be true. You do have to
Yeah.
pull all the pieces together more than surgery, in terms of like looking at all of the different possibilities. But with the not doing anything, the rotas on medicine have been worse than my surgical rotas at times, for sure.
Yeah.
So I think obviously, like, we talked about all the different like sort of stereotypes of, you know, being a medic, being a surgeon, and being a GP, and sort of debunking those sort of theories. So I think we'll bring it to a close, and thank you very much.
Thanks very much, guys.
Thank you.